Is it a little tender?
Actually, I never had physical therapy before, so...
See. Okay. Is it too warm?
No. That's good.
Should go a little higher?
No.
And we're gonna warm up the area. Work a little bit. Hey, how are you? My name is Dr. Amber. How are you doing today?
I'm good, thank you.
And what's your name?
April ASMR.
Oh, hi, April. How are you?
I'm very good.
Good. What brings you in today?
So I went to the primary care physician 2 days ago.
No, give me 1 second. I'm gonna. Here you go. Okay, go ahead.
So the primary care physician said I need some physical therapy. I've been having some problems with my left hand. So she suspects a carpal tunnel syndrome.
Okay.
And I also have pain on my lower back, on the lumbar area, that it's bothering me for a few days now. Actually, maybe 2 weeks.
Okay, how high is the pain? If you were to describe your pain using a scale from 0 to 10, saying the 10 would be the highest pain you've ever felt and 0, no pain at all. Where would you...
So here it's around 4 to 5. Sometimes it's more intense when I do certain movements with my hand.
Is it burning? Is it sharp? Is it radiating?
Is it sharp? I also feel some pins and needles.
In your fingers?
Yes.
Is it worse at night? Does it
yes.
get worse at night?
Yes.
Okay. Is it bothering you more in certain positions?
Yes. When I do a few movements, yeah, it bothers me more.
Like when you're typing or...
yes, especially at night when I'm working a lot and I'm staying at the computer a few hours, then also I feel my hand a little bit like weak.
Oh, okay, some weakness. And it's only your left hand or?
Mostly yes.
Did you notice anything in your right hand?
Maybe just a little bit, but not so much like the other one.
Okay, is it going up your arm sometimes? Do you feel it?
Sometimes to the elbow maybe. Okay. Not all the time, but yes.
Okay, that makes sense. Okay. And how long had you had the carpal tunnel pain for?
For maybe a week. But
okay.
I went to the doctor 2 days ago. I had this problem for a week, but some symptoms I have it for longer period.
Okay. Now let's talk a little bit about your low back. So you said you have some pain. How high is that pain? Same scale from 0 to 10.
Like 5 or 6. When I'm standing, maybe too much, or when I'm tired, especially at night, I do feel a lot of pain, and sometimes it go down, radiates towards the leg and the toes.
Okay, and it's your right leg, correct?
Yes.
Okay, and did you notice anything helping you? Like, do you apply any cream, like anti-inflammatory, or
sometimes
any medication?
I'm taking ibuprofen, but that's it.
And is it helping you? Is the pain decreasing?
Yes, not so much, but it does help.
And what about some movement? Is it worse when you're doing some movements? Does it get better when you're doing other movements? Like when you're walking more, did you notice? Have you noticed?
Yeah, when I'm walking more, it hurts more. When I'm standing in the bed, it's better.
Okay, so when you're laying down, so at nighttime, can you rest?
Yes.
Okay, so the pain is not that bad at nighttime.
Yes.
With your low back. Okay. Any medical history that you think it's relevant, like a history of cancer or blood clots, or if you're taking any medication that we should be aware of?
No, I'm not taking any medications right now, just some ibuprofen. No, I don't have any family history. Okay. Just maybe some heart problems from my mother's side.
Do you have them, or
no,
is just
it's just like a history.
Okay, but do you have anything like palpitations, an implant somewhere that would affect our treatment?
No.
Because our machines and the treatment we do here is pretty safe, but we do have some contraindications, like cancer is the main one, and then pregnancy, You're not pregnant at the time, or do you
No,
plan on
I'm not, no.
getting pregnant? No. Okay, great. That's another one. And then some types of treatment, we cannot work on implants, or if patients are on certain medications, or of course if they're consuming alcohol.
No, I'm not drinking.
Do you smoke? Because
No.
that would affect your bones sometimes. Our
No.
bones get more tender. We do tend to have certain problems exacerbated if we're a smoker.
No, I'm not smoking. I'm
What
not
about
drinking.
your lifestyle? Do you exercise? Are you more sedentary?
Not really. I'm not exercising.
Okay, so can you tell me a little bit about your, daily routine? Like your work involves sitting a lot, standing a lot, right?
Yeah, I tend to sit more. Not all the time, but yeah, I'm not going to the gym or so. Just sometimes I try to walk more. But
Does your job involve lifting any hard objects,
No.
bending a lot, switching positions often?
Not really, but
Okay, well, let's start with a couple of advices, if that's okay with you, and especially for your low back. What I would do is advise you, even if your job requires you to sit for so many hours during the day, we can't change the job, but we can try to change our habits. So what I want you to do is try to kind of check the clock. You can set an alarm, and every hour or so, or I would say the most 2 hours, stand up and move for a bit, change position. You can try standing up. I know these days they have those offices where you can actually bring your computer higher and you can work standing up, and then you can sit down. You can walk for 5 minutes, go to the bathroom, come back, try to avoid sitting in the same position for a long period of time. And then maybe you can use a little pillow for your back,
I will try.
for your low back. There are different brands. That's something you can check on, see what's on the market. Also, what I'd recommend is wearing comfortable shoes. They do affect your spine, so if you're going to wear heels, it does make a difference on your spine compared to when you're wearing something comfortable that has a little bit of sole, and it's going to help you in your entire posture. You need to have something comfortable that stays on your foot most of the time. Now, if you're going to go somewhere special and you wear heels, that's fine. But keep in mind your shoes are important for your spine, your posture. If you're moving, it would be great if you could incorporate some exercise during the day, maybe 2-3 times a week, some stretching, some light exercise. You can start slowly and progress to harder exercise. Don't start all of a sudden, because I've seen it before. A lot of my patients would do that. They want to start it all in one day, and it doesn't work like that, unfortunately. And make sure your chair is comfortable, okay? So it's important that we have a comfortable chair that's adjusted to our height and our body. You have armrests, you can rest your arms. And also, when we're sitting at the computer, we want to look at the computer straight forward. So you don't want your computer to be too far away, because you're gonna have a tendency to lean over and look at the screen. So your whole back is gonna go like this. So make sure it's adjusted the proper position for you to be comfortable, and you don't have to lean over. You don't have to stretch or anything like that, or twist, or everything is adjusted so you're comfortable. Okay? Makes sense?
Yes.
And then just a little bit of changes in your life. It's going to do a lot of good, okay, for the long term. Make sure you don't lift any hard objects, okay? Even if you're going to lift something, make sure you bend your knees. So you don't do this. You actually bend your knees and lift up, okay?
Sure, I will try that.
We can discuss more during the session. Now, what we're going to do today, we're going to try this machine. It's really comfortable. It's like a little massage. It's going to warm up the area, but we do need a couple of sessions, okay? So whatever is going to happen today, it's not going to be a big change, but I do hope you can come back, and then next time we can try again.
So how many times I have to come?
I would say at least 6.
6.
But we'll see how it evolves, okay?
Okay.
Well, after 2-3 sessions, we can kind of figure out what's going on, and then we'll take it from there. Does it sound good to you?
Yes.
Okay. See if there's any difference. I'm just gonna palpate. Let me know if it hurts anything, okay? So, do you feel any pain?
Just a little bit.
A little bit, okay. Is it? How about this way? Is it a little tender?
Not so bad.
Not so bad. Is it going up?
Yes.
A little bit, right?
Yes.
Let's see.
Oh.
Actually tense. Okay. Just relax for a second. Let's see. Relax. You can relax. Does it hurt?
No.
Okay. Going up. No pain, right?
No.
Okay, let's see if there's any difference in range of motion. So, can you squeeze first of all? I'm gonna see your strength for now. Squeeze really hard.
Yeah, I'm squeezing.
So good. There's a little bit of difference. This one is definitely a little weaker. We have to work on that, okay? But once the inflammation is gonna go down, it's gonna get much better. You'll see. Go down. Oh, it's actually cracking.
Actually, I never had physical therapy before, so it's something new for me.
It's gonna be interesting, right?
Yeah.
Are you nervous?
A little bit.
Okay. Good. Now can you do this? Okay. Okay. So now I'm just gonna try something else. What I want you to do is push in my hands, okay? Just kind of try to bend your elbows at the same time and push really hard, and I'm gonna push too, okay? So you're gonna feel some resistance. Okay, good. And now we're gonna go down right from this position. You're gonna push down just from your elbow, okay? Try not to use your... Okay, great. Okay. Good. Let's do some measurements. I'm just gonna measure, see if there's any difference, if there's any swelling. Okay, let's see. Okay, this is that, and we'll do the other one. See. Okay. Yeah. Okay. There we go. Okay. Not really much of a difference, so I wouldn't worry about that. But tell me, have you been wearing anything tight on your arm, like a tight watch or anything like that?
A watch, just a watch.
Yeah, try to avoid that, okay? Because it's gonna compress on our nerves, so it might affect. Okay. Okay. Is it comfortable?
Yes, it is.
It's a little tight.
It's a little bit tight.
Okay. Better?
Yes.
Okay, just relax your arm, okay? Okay. Is it okay if I remove this? Just in case. Okay, this one is gonna be a little bit cold, okay? So give me 1 second. We're gonna apply some gel on it. It's gonna go like this. Then we're gonna make sure it's in there, because otherwise it's not gonna feel so great. So even if the gel is not there, nothing bad is not gonna happen, but the problem is it's not gonna be as effective without the gel. Okay, so now it's gonna be a little bit cold, so go gently. Let me know, is it too cold?
No, it's fine.
It's fine. Good. So now apply some gel on this one, and I'm gonna have 2 heads at some point. I am going to change them, so you just have to relax, okay? Are you comfortable?
Yes.
So better? Getting warmer, right?
Yes.
Is it too warm?
No, it's good.
It's comfortable, right?
Yeah, now it is.
It's down.
It was a little bit too warm before.
It's also, you know, it's more painful because of the inflammation, but it's gonna get more comfortable over the next sessions.
Thank you. It feels very good.
Okay. Next, we're gonna work on your back too, okay?
Okay.
Okay. So, for your back, I'm gonna change the settings. Okay, let me wipe you. Give me 1 second. This is just gel. It's not gonna leave a stain or anything like that, okay?
Okay.
It doesn't have any properties, it just helps the machine. Doesn't have any smell or anything like that, okay? So, nothing to worry about. Okay, and now, here, let me help you with that.
It's a little bit tight, but it's okay.
Okay, I'm gonna pull this down just a tiny bit. Is that okay?
Mm-hmm.
Okay, so now I am going to start the machine. Okay, and it's gonna be a little cold at the beginning because it's cold, right?
Mm-hmm.
So raise the gel. Okay. Okay, but it's gonna warm up. Is it okay?
Yes.
Any weird feelings?
No.
You sure?
Mm-hmm.
Let me know if anything, okay? I'm just gonna go on this area. It's not very warm, right?
No.
Should I go a little higher?
No.
Okay. Now I'm gonna press a little bit if that's okay.
Mm-hmm.
Is it comfortable?
Yes.
And I'm not going on your spine, okay? I'm just going on your muscles, close to your spine, but I'm not going on it, okay? How are we doing?
Good.
Roll down. I'm gonna do a little bit of massage, like a deep tissue massage. And that's gonna be it for today. Does that sound good?
Perfect.
Okay. My triple gel.
Mm-hmm.
Okay, just gonna get some more gel. This is gonna be cold though. Cold? Sorry. One more. Okay. Better.
Yeah.
More gel. Should go a little higher?
No.
Okay, maybe next time.
Yeah.
Still doing good? Is it okay?
Yeah, it's warm.
Warm enough? And we're gonna warm up the area. Let me know if there's any pain, any discomfort, okay? I'm gonna go gentle. If it's too much, you let me know.
Yeah, a little bit of pain on the right side.
Right here?
Yes.
Okay. Okay. Pain.
A little bit. Oh.
Okay. I'm gonna try something. Got a little tool here. This first. We're gonna work a little bit. Your quadratus lumbaris. Try to reach. How's that?
Good.
I'm gonna go both sides. Is that painful?
Yeah. Ow. It is painful.
Well, that's usually painful for everyone. It's a tense spot. That's your joint right here. Is that painful? Right about here. The painful.
It is, but it's more on the right side.
Okay. Is the pain going down your leg?
Not on this one.
Good.
Oh.
Okay. I'll go spine. Okay. Good. I think that's it for today. Is it okay if I pull this back?
Mm-hmm.
Let me help you. We're gonna sit up very slowly. So what I want you to do is roll on the side. So what do you think? That's it for today.
Yeah.
How was it?
My back feels so good right now.
You know, sometimes some patients would describe more pain after the procedures after the first sessions, but it's normal, okay? Not everyone does, but some people do, so it's nothing to get scared about, or there's no alarming thing.
Thank you so much for everything.
But remember, you have to try to do this for a couple more sessions. Just one session is not going to do any good, okay? So I'll see you in a couple days.
Sure.
Or next week. Okay, we'll schedule an appointment, okay?
Thank
At the
you.
front desk. Thank you so much.
Thank you so much.
It was nice seeing you.
Nice to see you. Bye-bye.
Bye.